Let me tell you something. There is a lot more to labor than meets the eye. And in this video, I'm going to take you through the stages of labor, let you in on what's happening in each stage, what you can expect, and some coping tips for each. So let's get started. Hi, I'm Ashley, and I'm a doula, a birth photographer, and a childbirth educator in the Greater Toronto area. And I'm extremely passionate about informed and empowered birth. Make sure you subscribe to my channel so you don't miss any tips, tricks, and advice to get the birth experience that you want. If you're watching this, you probably already know what dilation is and why it's important. And it's really easy to get hung up on that number, but it's important to remember that there is so much more going on during labor than just dilation. With every contraction, there are 5 things happening. Your cervix is dilating from closed to 0 or 10 centimeters. It is effacing, which means it is thinning and stretching. It's also softening, both of which allow it to dilate. And I'm going to talk about this more in another video, so stay tuned for that because it's actually really super cool how the cervix works to dilate, to let your baby through. The cervix is also moving from a posterior position to an anterior position, and your baby is rotating into position for birth and descending into the birth canal. So let's talk about the first stage of labor, which has 3 phases. There's early labor, active labor, and transition. In early labor, you may find your contractions are really all over the place. They could be coming every few minutes and then spaced out every 30 minutes. Your cervix is dilating to around 6 centimeters, which is the current recommendation for what constitutes dilation during early labor. So from 0 to 6 centimeters is considered early labor. And effacement can be anything in the range of 0 to 100%. But the important thing is that your cervix is effacing and softening so that it can dilate. You should be able to talk and walk through your contractions in early labor, and you may feel confused as to whether you're actually in labor. Like, is this really it? Is this really happening? These are all really normal feelings to have. The best thing you can do during early labor is to rest. Use distraction techniques if you need them. Listen to some hypnobirthing tracks if you're into that. Whatever makes you feel comfortable. It's okay to periodically time your contractions during this time, but I don't recommend doing it religiously because it can be discouraging if they're all over the place. So maybe time a few, then take a break for an hour and repeat. Now, active labor is where the fun begins, and this is also usually the point where your doula or birth photographer will join you, and also the point where you'd be thinking about heading to the hospital or birth center if you're not planning a home birth. In active labor, your cervix is finishing effacing and is dilating now from 6 centimeters to 8 centimeters. And your contractions are coming every 4 to 5 minutes or less, lasting for a minute or more, and that pattern lasts for at least an hour consistently. This is called the 411 or the 511 rule, depending on who your healthcare provider is. And you might hear this referred to in your prenatal appointments. It's really just an easy way for you to remember that active labor has started and it's time to call your healthcare provider and your doula or head to your place of birth. In active labor, you likely won't be able to walk or talk through your contractions, and you'll be relying on your comfort measures to get you through them. It's important to do whatever feels right for you through this stage, whether that's bouncing on a birth ball, or maybe it's getting into the tub, or maybe it's using a TENS machine, whatever it might be. Also, remember to stay hydrated and pee often, even if you feel like you don't really have to go. Finally, there is the transition phase, which is by far the hardest part of labor, but also the shortest. Contractions may feel like they're coming one on top of another without a break. If there's any effacing left to do, this is when it will happen, and your cervix is also working to dilate completely to 10 centimeters. During this phase, you won't be able to talk through your contractions, and it's also super common to feel overwhelmed, out of control, and like you just can't keep doing it. But these are all normal and really good indications to your doula that the end is near. You may also feel nauseous and throw up, but I want you to remember that this phase does not last long, and it means that you, my friend, are near the end and almost ready to finally meet your baby. So you've effaced and dilated completely, and now we're in stage 2 of labor, which is the pushing phase. For a first-time mom, it's not unusual for this stage to last for 2 or more hours, but rest assured that you're not pushing continuously for that long. You'll be pushing through your contractions, which will come every 1 to 3 minutes and last anywhere from a minute to about a minute and a half. You'll probably feel lots of pressure and an urge to push, and it's important to remember that this is the last leg of the race. You're almost there. It may feel at times that you're not making any progress, but I promise that with every push, your baby is descending. So now, congratulations, your baby is born, but it's not over yet. Welcome to stage 3, which is honestly something that you may not even fully remember. This stage is where the placenta is delivered, so your contractions have mostly tapered off, and within about 10 to 45 minutes on average after birth, you'll deliver the placenta. And if you haven't discussed it beforehand and declined, you'll receive a shot of Pitocin in your leg if you haven't had an epidural. And if you have had an epidural, they'll give you a dose of Pitocin in your IV instead. This is to prevent postpartum hemorrhage, and if that is something that you don't want to do, I recommend bringing it up with your healthcare provider before your birth to discuss what your options are in regards to getting Pitocin after birth. So there you go. That is a quick rundown of what you can expect during labor, though it's important to remember that every person, and for that matter, every birth, is different, and you may find that yours doesn't follow the typical pattern, which is totally normal. I also want you to keep in mind that if you have pain medication, or if you have an epidural or any other type of intervention, that can change how labor progresses and what you feel during those stages. For example, with an epidural, you may not feel an urge to push as much as if you didn't have an epidural. Don't forget to grab your free printable birth affirmations from the link in the description so you can get into a great headspace before your birth. And these can also be used around your birth space as reminders that you've got this. If you're interested in learning some natural ways to kickstart your labor, check out the videos on natural labor inductions. And if you liked this video, hit that like button and be sure to subscribe and share with anyone in your life who is pregnant or a new parent. Thanks for watching, and I'll see you on the flip side.